Hi, my name's Tim, and today we're going to be doing continuing and discontinuing a peripheral IV. I have a 22 gauge, so we're going to go ahead and give fluids. I gathered all my supplies. I'm going to go ahead and insert my patient's room. Wait to be greeted in. I'm going to close the door behind me for privacy and introduce myself to the patient, and as well as wash my hands. Hi, Mrs. Smith. My name's Tim. Can I have your first and last name and date of birth? Okay, great. Thank you. So it looks like the doctor ordered you some fluid, so I have a 22 gauge needle. We're going to go ahead and start an IV for you. Is that okay? Okay, great. So once again, wash my hands. Do you have any allergies or anything? No? Okay, this procedure should take about 10 minutes or so to get started. It shouldn't be long at all. I appreciate your patience. Thank you so much. And so while she's getting comfortable and we're hanging out there, we're going to go ahead and prep our IV extension here. Some normal saline. Make sure it's not clamped. And all we're doing is we're going to make sure that this bevel has enough water. Perfect, just like that. No air, nothing that we want. Okay, great. We're going to go ahead and get this tourniquet here set up. We're going to wrap around the patient. We just want it taut, nice and taut, but not cutting off, not too tight. We're going to feel for the distal pulse as long as we feel that. Okay, great. Perfect. So what we're going to do is we're going to go ahead and start by cleaning our site. First we go circular motion here. We're going to go ahead and get our IV set up. This will go in the trash. We're going to get our IV opened. And the main thing we want to note is that we're going to have the bevel be at a bevel up, and we're going to insert at a 45-degree angle. I'm going to start with my non-dominant hand. After this zone, I'm going to hold the skin taut here, and we're going to go about a couple inches above that, making sure the bevel's up. We're going to insert in about 45 degrees and wait until we see some flashback of blood, and when we do, we're going to go ahead and flatten out there and just continue about another fourth of an inch, not too much. Now, right about there, and we're going to go ahead and click our safety device, and we're going to hold this in place here. We're going to get rid of this in our sharps container. We're going to go ahead and get our Tegaderm and get that all set up here by keeping this in place. Sorry, not Tegaderm. We're actually going to get this connected here first. My apologies. We're going to make sure that we have some drawback of blood. And I see drawback, and then we're going to advance this as well. Make sure she tolerates it well. Perfect. She's tolerated that well, so we'll get this off here. Set this to the side. Our goal is to get our Tegaderm on now. We're still holding this in place. Our goal is to keep that there nice and taut. Perfect. We're going to hold this in place here. And get rid of this excess here. I also want to note that I did clip this to where once I was done filling your drawback, this was clipped. I would make sure of that prior, and I would undo this here. And once that is done, I'm going to go ahead and I have my thing here that I need to write on. We're going to go ahead and write on our slip. We're going to write the date. Initial time. And size of needle, which is our 22 gauge. Place that right there. Okay, great. We're going to go ahead and just take our tape here. tape this up here. Just out of the way. And then once that is done, I will go ahead and our IV is set. I'll ask her if she has any questions for me. If not, then I would go ahead and remove my gloves. I'd get all my trash first and throw everything away. Get it all out of the way here. I'm going to keep my stuff for my next part. I'll get rid of all my trash. Make sure all the stuff that's in the sharp container needs to be in the sharps container, and throw it away. Okay, I'm going to take my gloves off, throw that away. Wash my hands as I exit, and I would document my results, how the patient tolerated it, how everything went as far as the placement and all that. So now about discontinuing. I know this is one video. So discontinuing, I would go ahead and knock on the patient's door, wait to be invited in, close the door behind with privacy. I would perform hand hygiene, and I would let the patient know what was happening. Hi, we're going to go ahead and remove that IV. It looks like your fluid level is back to where it needs to be. The doctor is happy, so we're going to go ahead and take that out now. So we go ahead and put some gloves on. And the main thing we need here is some gauze and then tape to actually tape the gauze. So we're going to go ahead and remove this. We're going to start pulling this back here. And we're going to keep, when I want to go parallel with the skin, we remove this. And when we pull this out, we're going to identify this IV catheter, make sure that there's any marks or anything that we need to document. We'll go ahead and document. We'll keep this pressure on here for about 30 seconds. We'll toss this in our sharps container as well. And we'll go ahead, and after about 30 seconds, we'll go ahead and tape our gauze. And before I leave, I'll ask my patient if everything's okay. Make sure the bed's in a low position. Make sure his water and everything is by the side and call light within reach. And go ahead and document my results. I'll take my gloves off, and I will go ahead and throw away my trash, and I will exit the patient's room and make sure to document my results. Thank you so much.